All right, once again, we're live here at the Johnson City Medical Center, the Heart Hospital here at the Johnson City Medical Center. I'm joined by a very familiar face, our cardiology specialist, Dr. Shoba is joining us this morning. And Dr. Shoba, we're talking about Go Red for Women today, and we want to talk about some of the different aspects of heart disease and heart attacks and things of that nature, the way women need to pay attention to their bodies. And talk to us about some of the things that women can do to help reduce their risk of heart disease.
You know, it is very correct that heart disease is very prevalent in our Tri-Cities area.
Right.
And women are at very high risk for heart disease, you know, just like men. In fact, heart disease can strike you at any age. Children can have heart disease, women can have heart disease, and men can have heart disease, and age is no bar. You can be a young woman and still have heart disease. There are different types of presentation of heart disease. You know, classic example of how women can present with a heart attack would be, you know, a chest pain going up into the neck, down the arm, pain in the back, between the shoulder blades. I mean, men and women can present this way. But women sometimes can have more subtle signs, but this is also true of men, unfortunately, and we ignore men with these subtle symptoms. So what I'm saying is true both for men and women, but more women may present just with, you know, feeling very tired, feeling more short of breath with exertion, ache in the back between the shoulder blades, kind of more lower down discomfort, just, you know, shortness of breath getting worse, and that could be the only sign of a blocked artery getting worse. So if you have any of these symptoms, it is very important to get tested right away.
And the big thing is, if you start having these symptoms, call 911 immediately, and do not try to drive any of those. I mean, just take care of it immediately.
That's right. It's very important to call 911 because you do not want to get in the car behind a wheel and try to drive yourself and have a heart attack, you know, full blown in the middle of the street. Not only that, when the ambulance comes to your place, they actually have life-saving measures and medications that they can administer right on the spot, saving time, because time is muscle.
Right.
When you have a blocked artery in the heart, once the muscle is dead, we do not have good ways to get it back to life. You know, once it's dead, it's gone. And so time is of very great importance.
And we're talking about Go Red for Women today, and this is National Heart Month, and it is something, though, that women and men, for that matter, need to take seriously all year long and throughout their lives.
Yes, very important. You know, they've chosen February for Heart Disease Month, coincides with Valentine's Day. Exactly,
Affairs of the heart, right?
Heart, so the key is to start young. How you raise your children now will determine at what age they have a heart attack. If our parents had heart attacks, say at the age of 60, that puts our generation at the age, you know, 10 years younger at the age of 50 to have heart disease just because of our lifestyle choices.
Right.
Previously, they were farmers, worked very hard, they burned whatever they ate.
Right.
But we just sit in our cars, drive around, get a burger, French fries, pizzas, and then just sit around. We park our cars in front of our house or in our garage and then just drive to work. You know, we do not have the exercise built into our lives like our parents did. So we've realized that heart disease strikes us about 10, 15 years younger than it did our parents. And unfortunately, that's going to be even worse for our kids when they grow up because they have been eating this bad stuff right from the get-go. And now all they're doing is sitting and watching TV, playing computer games, and they are being brought up in a world of stress.
Right.
You know, we have stress in our lives, but our kids seem to have even more stress than we do, and they probably have even lesser coping skills for stress compared to what we have. And so eating right from a young age and teaching them about the importance of incorporating exercise into your day-to-day life. At work, we need to try to exercise even at work. You know, every 5-minute break that you get, see if you can put in a little exercise. You know, park a little further or take stairs. You know, do exercises standing in place, and it is very doable.
Right.
Very, very doable.
And you hit on stress, and I want to touch about this. Men and women deal with stress differently.
Yes.
And do you find that women are becoming more like men as far as stress goes,
well,
or are men becoming more like women?
The problem is, you know, more and more women are in the workforce and in the same kind of jobs that men are, and work brings a separate stress in life.
Right.
And at home, you know, both partners are going home now, and you know, the time that is spent at home is going to be lesser and lesser, and all the work that at home, you know, piles up, and the responsibility of taking care of children then piles up. So there is somewhat more stress in life because, again, like I said, I think women are now getting into the same workforce as men. However, in general, I think men tend to internalize their symptoms more, and I've seen that in my patient population. and they will open up in front of me and talk about the stress which they cannot discuss at home because they do not want to disturb their spouse. And I don't know how women are. Women are more vocal probably. They try to talk about their feelings and they are more likely to express their symptoms. However, I've seen that both populations at this point in time do not seek medical help and regular checkups early on.
Like they should.
Like they should.
All right. Dr. Shoba, thank you so much. Great information that we can all use, especially on this Go Red for Women Day. And we have some information right now about the Johnson City Medical Center Heart Hospital here. If you need help, if you're feeling any of these symptoms, check this out today. Check out that information. It can save your life.